You can start when you want, Carol.
Hello. Oh, we'll just mute that, Tina. Thank you. Hello, my name is Carol Shanks. I'm one of the community COPD nurses, and I've been asked to speak to you all about inhaler technique today. So I've got a few slides. I'll just share them with you. Everybody see that?
Yeah, we can see it.
Yeah, good. Okay, so I'm just going to talk to you all about the different devices and all about inhaler technique. And then if you've got any specific questions for different inhalers, we can talk about those later. So the main spacers and holding devices that you can use with spray inhalers are the air chamber and the volumatic that you can see here in the picture. This is an air chamber that you can see it's got a mask on it, but I have one here that's got a mouthpiece. So if you use spacers, they ensure that most of the medication gets into the lungs. Yeah. Fiona, could you just mute that, please? Patients don't have to, with a spacer, patients then don't have to coordinate pressing and breathing in the medication. And if you use a spacer, it extends the amount of time that the inhaler takes to deliver the medicine, and the lungs absorb the medicine slower and more smoothly. Okay, so if you, with the small air chambers, they have a one-way valve in them. So you can breathe the medication in, but can't breathe it back into the chamber. So we always ask the patient to shake. Can everybody see me? Is that okay? Can you see me, Tina? Yeah. Yeah. If you can shake your inhaler first to disperse the medication in the suspension. Pop the inhaler into your chamber. And then we always ask the patient to put the medication, the one spray only, into the chamber, and it holds it there for you till you're ready to breathe it in. And then we say take about 3 normal breaths to inhale that medication. So it's a and if you breathe it in too quickly, the chamber will whistle, and that just shows to them that they've got to slow down. With the volumatic, it works exactly the same way, except there is a 2-way valve in the volumatic, so you can breathe in and out of that spacer. So there is just a slide of the spray inhalers. Just one thing that we wanted to mention was with people with COPD, some of them generally use about 2 Ventolin inhalers per month, and a lot of GP surgeries will only prescribe 1, and they struggle to get another one from the GPs. So just to be aware that we're quite happy for COPD patients to have 2 Ventolin inhalers per month. And this allows them then to be more active, which is obviously very important. And the other thing we just wanted to mention was that don't use a chamber with a breath actuated inhaler. So if they've got a Salamol Easy Breathe, or they've got an Aeromere, then these don't work with spacers. We see a lot of the time when we go in patients' houses, we see them taking this off, trying to fit them in here, which they won't. And obviously these breath actuated inhalers are a lot more expensive than the MDIs. So just be aware that if they've got a breath activated one, it won't work at all with a spacer. Okay, so those are the spray inhalers. So it's important to make sure that the patient can use the device. You must check for inspiratory effort. With a spray inhaler, you don't need as much puff as you do with a dry powder inhaler. And these little devices that you can get from GSK are really good to check whether they've got enough inspiratory effort to take a dry powder inhaler. You can, the GSK will supply you with loads of these. They're very easy to get hold of. And you can give these to the patients. And if they can't make it whistle, then they haven't got enough puff. So all they do is breathe it in, and that shows that they've got enough puff to take a dry powder inhaler. So on this slide, I've just put a few dry powder inhalers there, which you'll all be familiar with. The main reason for, or one of the main reasons for prescribing a dry powder inhaler would be because they do tend to be a lot less fiddly than a spray inhaler. The elliptic devices are very common at the moment, very popular, and these are really easy to use. They've got a nice big counter on the front. You just slide it back, and then it's a good deep breath in. And these can be quite good for patients with arthritic fingers that struggle to press spray inhalers, and if they haven't got any strength in their fingers to press a spray inhaler. And also the elliptic devices, they're only once a day as well. So patients who are not very compliant, the elliptic devices are quite good because once they've taken it, they don't have to take it again for the rest of the day. Okay, so like I say, with a dry powder inhaler, you need a much harder breath in, so just be aware of that as well. And any inhaler that's got inhaled corticosteroid in it, you need to rinse your mouth out afterwards, because you can get thrush quite easily with these. The other inhalers are the mist inhalers, which are on the G-triple-MG guidelines at the moment. So these come in a LAMA, and then a LABA-LAMA inhaler as well. That's a spiral. So they're a bit complicated, but chemists will tend to prime them for the patients. But they come like this, and you have to pop the cartridge into the inhaler and really press it down quite hard. That can be quite difficult to do for an elderly patient. And then you've got to fix the bottom on as well. So these can be a little bit fiddly again for patients. So again, just be aware of that. I mean, the good thing about them is that they administer the mist, which is quite easy to breathe in, but they can be very fiddly. So if a patient's struggling with that, then maybe you should think about changing their inhaler. Right, so this is a slide just showing you different LABA-LAMA inhalers. You've got a couple of dry powder ones there. You've got the Duoclear and the Onoro, and the Ultrabro there as well. Those are all the dry powder inhalers. The new one there is the Bivespi. That's brand new. We've had a couple of patients try that quite successfully. And then the triple therapy inhalers. Again, we've got a brand new Trixeo, and then a dry powder one and a meter dose spray inhaler there. So just finally, I just wanted to make you all aware of the Right Breathe app, which is free to download on a smartphone. And once you've downloaded it, you can just look for any inhaler on it. It gives you all the details of the inhaler, and it also at the bottom gives you a demonstration on how to use that inhaler. So it's really good for yourself and to show patients. So I just wanted to make you all aware of that. So that's a Right Breathe app. So that's all I've got to go through with you. So if you've got any questions, anybody got any questions, you can either shout them out or put them in the chat. there anything Tina or Fiona wants to add to that?
No, it's just making sure you get the right inhaler to suit the patient.
Yeah.
Don't choose the drug, choose the device.
Yeah. So yeah, it's mainly about getting the right device for the patients, to look at what the dexterity in the fingers, whether they're compliant, their inspiratory effort, and if you get the right device, then they're going to have better disease control, because they'll be getting more of that medication into their airways where it needs to be, and then we're not having to, you know, think about nebulizers and oromorph and all sorts of other things to help control the symptoms. If we can get, especially with the triple therapy inhalers, because you've got 3 good long-acting medications there, and if the inhaler technique is not good, then they're just missing out on all the basic inhaled therapy.
Yeah.
So have you any questions about any inhalers that you are worried about or have tried, or no? I mean, we are always here. There's always somebody in the office every morning. So if any of you have any worries about any inhalers, you just want to give us a ring, you'll always get through to a nurse if you phone up in the morning, and we can talk you through whatever worries or problems you have. Yeah, you want, yes, I'll get Jeannie to give you the number for the service. We also have an email too, if you would rather do that, and I'll make sure you all get the copy of our phone number and email. Right, I think that's it then, is it? Everybody happy enough? Like I say, I'll type in the number now, and I'll get Jeannie to send that through to you all. But thank you all for attending, and like I say, if you need to speak to us about anything, just give us a ring in the morning, Monday to Friday. Okay, thank you very much for attending.